Tonight, my first guests are Dr. Elizabeth, you're going to have to help me here.
Pelkowski.
I knew I wouldn't be able to get that out. Who is a GYN or gynecologic oncologist. And Jessica Schrock, right? I got that right? Schrock, okay. I didn't get either one of them right. And you work as a nurse practitioner with the same group.
Yes.
So you guys are the specialists in cervical cancer or gynecological cancers. And you see a lot of women. And the cervical cancer, we didn't used to, or at least kind of like, it went away. But it's really important and it can kill people.
Absolutely. So while about 12,000 American women are affected by cervical cancer each year, it's one of our lesser common of the gynecologic malignancies because the story is really not the cancer diagnosis, but how successful we've been in prevention.
Mm-hmm. You mentioned prevention, and the Pap smear is the standard. Mm-hmm. Who, what, when, how often?
We like to really focus on the Pap smear at the GYN annual well-woman visit. That's basically the best place to start, and that can be done at your primary care office, your regular OB/GYN office, or we do those in our office as well.
What age do you start?
Typically you want to start screening at age 21, and that's based on the newest guidelines. And then we screen either every 3 or 5 years, depending on personal history, Pap smear history, and sometimes family history.
And how long do you screen?
Generally, you screen up until the age of 65, depending on what patient's prior history is.
Also depends on the health of the patient and what their desires are.
Certainly, and other medical diagnoses that they may have that may affect screening.
And when you do the Pap smear, you also look for, I guess, causes. And I don't know if cause is the right word, but HPV or the human papillomavirus is considered to be at least a risk factor for cervical cancer. Tell me about that.
It's scary for patients, so we do a lot of HPV counseling.
We do. So when we do a Pap smear, you can do it a couple different ways. You can test the cells only, you can test for the HPV virus only, or you can do a co-testing and do that together. Most groups will test for the HPV if the Pap smear comes back abnormal. And then we can kind of correlate our recommendations for the next steps based on that. If there's high-risk strains of HPV present, then we know that those patients are going to be higher risk for cellular changes that can lead to cervical cancer.
And over the past several decades, the knowledge that we've gained on human papillomavirus, which is this virus that, is sexually transmitted, 80% of sexually active individuals will get it, has really revolutionized our approach to both how we screen and treat and prevent with the HPV vaccine.
And there is a prevention. The vaccine, is it a 1 dose, a 2 dose, and how old when you get it?
Currently, it's a 3-shot series, but they're working on decreasing that interval to increase compliance. Really, the ideal age at this point in time is both boys and girls at the age of either 11 or 12, ideally, because we're trying to really hit HPV prevention, so prior to when patients might be sexually active or exposed. Now, you're not missing out if your child isn't 11 or 12. The actual true range is anywhere as young as 9 or as old as 26. And that applies to when patients may have even already had an abnormal Pap smear, or certainly when patients are already sexually active, they still should be vaccinated within that window because it's so effective.
All right, so if you have a diagnosis of cervical cancer, there's some treatment options. Briefly tell me what can you do?
Sure.
Well, we treat cervical cancer in many different ways, depending on the severity of the disease. Some patients need surgical intervention, some patients need chemotherapy, and some need radiation, and we work with our teams to provide all those treatments.
And it's based on the disease, the age. There's a lot of factors that go into how you treat the patient.
Mostly stage. So earlier stage disease we're able to treat with surgery most of the time. Later stage disease, typically it's a combination of chemotherapy and radiation.
Well, that's great information. We thank you for coming in. And now let's watch This Baptist Health Talks about gynecological cancers.
Gynecologic malignancies include cancers of the vulva, so the outside part of the female genitalia, the vagina, the cervix, the uterus, which is the womb, the fallopian tubes, and the ovaries. The common age to start screening for gynecologic malignancies is really with pap smear screening at the age of 21. Otherwise, it's regular good gynecologic care, going to see your doctor on a regular basis. If something is wrong, you need to present for medical attention. So for women, postmenopausal bleeding, persistent bloating, change in bowel or bladder habits, those are all reasons to come in and be evaluated. The services available at Baptist Health Lexington to help women with predispositions towards gynecologic malignancies include the genetic screening program. We have basic primary care, which is important for every woman, and that's where really the front line of diagnosis and getting referrals for women with gynecologic malignancies, that's where that occurs. We also have dedicated cancer dietitians. We make sure that they have a relationship with that patient so that we're protecting the patient before side effects develop.